address such events. So the testing doesn't tell you just a story about one person. It's a story about what happened when that person actually acquired the infection. And that helps you to trigger your public health interventions. Take Korea. When it started, the community transmission, it was actually in a religious event, really, and address thousands of people events ended up being. So the testing doesn't tell you just a story about one person, one gathering. It's a story. Their public health intervention to address not only that, but also other clusters. So without knowing, without testing, it's like moving blindfolded. So testing can help us not only to know the status of individual persons, but to know also what's behind it and take public health measures. And that's why we're saying testing is very important. And from testing, you can do the contact tracing. From there, you can also do the isolation. But we fully understand when there is community transmission, the health system could be overwhelmed. Even the public health interventions could be very situations. And the isolation may not necessarily be in a hospital or health facility. It could be in a community facility. Many countries have very innovative ways of isolating because their health system was overwhelmed and they had to actually look for community facilities. And then the last resort is when they couldn't do that and when they have a number of cases and when there is community transmission, then some of them resorted into isolation in their home, and separating their bedrooms and separating the utensils they use. But then let's be practical. Okay, you can have your own bedroom or you can have your own this or that to isolate yourself and to take all the precautions you need. But if it's in a if it's a one room where there is a big family, like 5 or 7 people in one room, how do you implement that? And then that's why we say we don't have a one-size-fits-all solution. And the solution should really be tailored to the situation of each and every country. So how do you implement isolation in a situation where a single family, a big family, is living in one room or 2 rooms and isolation is not possible at all? So that's why we say one-size-fits-all solution cannot happen. And each and every country knows its situation in terms of COVID situation. It knows its own social and other what we're saying. And of course, necessity is the mother of invention, and we expect a solution in every situation from the communities themselves and from the government and the country itself, because each and every situation is very unique, and each and every community knows the problems, knows the root cause of the problem, and knows the solution, and it doesn't need any prescription from anyone. The general guidance we give can help you to really get solutions in your own way. The most important thing is how can we trigger the human spirit in unison to address the problem that we are facing in each and every community. Thank you.
Thank you very much, Dr. Tedros. With this, we will conclude today's press conference. We apologize to all those who have not been able to ask the question, but there will be other opportunities. We will have an audio file sent to you in the next hour, and hopefully transcript will be posted tomorrow. Have a nice day and evening wherever you are.
Thank you, Tariq, and thank you for joining us, and see you in our next presser. All the best.